In recent years, the field of surgery has witnessed remarkable advancements in technology and techniques. Minimally invasive surgery, bariatric and metabolic surgery, endoscopy, and robotic surgery have revolutionized the way surgeries are performed, offering numerous benefits to patients and healthcare professionals alike. Dr. Dudsadee is one of the leading specialists in this field, with extensive local and international accreditations and hands-on experience in both Thailand and Japan. We caught up with him at Bangkok's Vimut hospital.
About surgery now, in the past we know that surgery requires big wound for remove something from our body. But now we have to deal with the problem of big wound and more pain. So we adapt and increase the technology and skill for smaller wound. As you know, keyhole surgery or MIS. My routine procedure are about the laparoscopic approach, and also I do bariatric surgery. As you know, it's a gastric sleeve procedure for treatment about the morbid obesity patients. My technique is patient safety first and cost effectiveness for everyone, because the safety and cost effective is the main part of my procedure. So I approach in keyhole surgery less invasive, and so the wound problem is no anymore. And our team at Vimut Hospital has highly skilled, more experience, and well management about the patient care for safety and cost effectiveness.
Minimally invasive surgery, also known as keyhole surgery, involves making small incisions rather than large ones used in traditional open surgeries. Specialized instruments, including cameras, are inserted through these tiny incisions, allowing surgeons to visualize and operate on internal organs. Bariatric and metabolic surgery are specifically designed to help individuals struggling with obesity and related metabolic disorders. This type of surgery aims to reduce the size of the stomach or reroute the digestive system, leading to weight loss and improvement in associated medical conditions.
In the modern day, the obesity problem seems high. Every country deals with the complication from overweight to obesity patients. So I also bariatric surgery that I specialize in gastric sleeve, minimally invasive surgery. My technique is cut off the stomach 80%, reduce the volume of the stomach, and additional technique is suture around the stabilize for improve the shape of the gastric sleeve, the good shape, the good result for decrease the weight, and control management of overweight, and also decrease the complication like bleeding or leakage of the gastric sleeve tube. And I think this technique is safe for patients and improve the outcome of weight reduction and management.
Another minimally invasive technique is endoscopy, a non-surgical procedure that uses a flexible tube with a light and camera attached to it to examine and treat internal organs. It's commonly used in colonoscopies and upper gastrointestinal endoscopies. Robotic surgery combines the precision of human surgeons with the dexterity and accuracy of robotic technology. These innovations offer a wide range of benefits for patients, and Dr. Dudsadee believes, as advancements continue to be made, the future holds even greater potential for further enhancing these techniques and expanding their applications.